she represents probably the spirit of Prairie. Every time that I take care of patients nowadays, I think about her and I said, this is what Maria would have done. I feel like I just cannot complain, because if Maria was here, she would not have said anything negative or bad.
She came and she was this cute little lady, beautiful, beautiful, and she always was very active, very moving around, and she knew everything. She was here a few months before Cesar, Dr. Coelho, he was telling us that Maria Teresa was coming. Maria Teresa was coming, and he was excited about the idea too.
I think this place would not have been the way it is without her. She was just different from the beginning, you know, full of energy, always wanted to be the best informed, very hardworking. She never wanted to be second to anybody. Only one time I won an argument with her. Only one time, and I'll never forget it. And every other time I had no chance.
She provided excellence, and she demanded excellence of our staff, of those that she surrounded herself with. And I think the staff came to realize that she loved them too.
She didn't do well with new people, okay? She liked to know that you knew what you were doing. And once you made that, crested that, then you were okay.
I remember the day that I scrubbed a BIV with her, because that's a big deal. And when we got done with the case, she looked at me and she goes, "That wasn't too bad." And I was like, yes, that wasn't too bad, I'll take it. I was like, that's a compliment right there.
She took the time to make me the best that I can be, and I always told her, "Dr. Falcone, I want to be just like you." She's like, "Nah," and I'm like, "Yeah." And it's true. I always wanted to be just like her.
She was a mentor. She was my mentor. She knew how to get the best out of the staff too. I mean, she pushed us to be better.
I think about new people's reaction to Dr. Falcone, and they always thought that she was angry, which cracks me up. She would come in some days and you'd think she was angry at the world. And she'd, nah, 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 nah. And she'd have something to say to everybody. And after time, I realized that she saw us as her opportunity to provide excellent care for her patients. She was our example, because once she got in front of the patient, that went away. She never did that in front of the patient. In front of the patient was the center of everything.
I would sit down with her when she was reading echoes, and I'd just be like, "Can you just teach me how, like, what are we looking at here?" And she loved it. She loved to teach people. If you asked her questions and you were willing to learn, then you and her would get along just fine.
The funny thing was when I knew I was completing my nurse practitioner, I wanted to be her nurse practitioner, but she said she didn't want one unless they made her get one. So she liked to be on her own. That was just it's her thing, and you know, we all respected her for that.
Overall, she has touched many lives in the last 15 years that she had been in this community. This was her house, this was her home. An excellent person, and it's just been very hard to move on without her in practice. It's just not the same. Practice has changed without her.
She's the backbone of the program. She was the spirit. Feisty, she's always stood her ground, had a heart of gold, and gave it her all every day.
I don't even know what it was about, but she just like hits me on the shoulder. I said, "Falcone, you can't hit me." I was like, "You better run." And then she just like looks at me and then starts running, and I like chased her down the hallway, down the lab, and my friend Amy, she had just started working. She didn't know any of the doctors. She like walks out of prep and she's like, "Why are you chasing Falcone?"
She had her outreach clinics, and so she would go to Des Moines, and everybody there knew her as Prairie Heart, and she was the entire program. So we were really fortunate to get somebody with her skills, with her intense ability to make sure that folks were aware of their condition, and that everybody around them that was taking care of them had a heightened sense of what their care was going to be like with Dr. Falcone around. She wanted to be sure that I knew and the staff knew that we were going to do everything possible for her patient, whatever that was. She wanted to do it quickly, she wanted to do it right, and she wanted her patient to feel better right away.
She was genuine. She just, if it was her patient, it was important to her that they got the right care at the right time with the right people.
Sometimes when I would say, okay, is this what you want? Well, of course it's what I want, you know. Just her personality. She had a very unique personality, and so I adored her for that.
She could not park a car. She could put a pacemaker like anybody. She did exotic things, and definitely one of the best probably in the nation, but could not park her car.
Probably my biggest experience with her was when I myself was diagnosed with cancer in 2013, and she was my biggest supporter. She was there the day that I got the diagnosis as I was working in the cath lab, and she was there with me through every step that she possibly could be as a friend and coworker. So it really meant a lot to me to have her be there for me.
After it was all done and when I went back to her for a checkup and had so many questions and so much fear, that fear sometimes overwhelms me because I remember how afraid I was, and she reassured me in a quiet and direct kind of way.
My patients always will say, oh, Dr. Falcone is amazing. And I'll say, yes, she is amazing.
She put that white coat on. She was a doctor, you know, and she was the best that she could be, you know, and she was the best doctor here. And you ask any of them, they'll all agree.
If I want to be a doctor, I want to be like Maria. I think that her children should be very proud of her. The last few weeks, I saw that she was taking her daughter with her around, and I'm very happy that there was those moments, and I hope that her children will always remember that she's one of the greatest physicians that we have had in Southern Illinois.
I guess that was the only one thing that was more exciting for her than what she did in medicine, is to tell you what was going on with the kids. She was very proud of both of them and loved them dearly. And you know, and Jeff, her husband, was always very supportive and understanding, and she really appreciated that very much.
I remember going to her house, taking her baby gift, and just feeling so welcome. You know, we were just two girls. It wasn't a doctor and a nurse. It was two girls, two friends, with a common bond.
I think she made us all better in some way, and it will just never be the same without her.
We're all going to miss her, her smile, her skills, and her ability to make sure that we all knew it was her patient we were taking care of.
It's wonderful to remember Maria, and it's impossible to forget her.
I think the practice will be different, very different without her. And I will miss her a lot.
I would say that Dr. Falcone left a lasting impression with a lot of us. She will be sadly missed but never forgotten.
She was caring, she's amazing, intelligent, and tired. She was never tired.
I think one thing that we can both agree on is she will be in our hearts forever, and she is the story. She's always going to be a Prairie.
None of us can really put into words what she meant to us as a coworker, a provider, a mentor. She taught us all so much.
She was in a man's world, and she made it work. And she did so with dignity.
It was hard to hear that she had passed because she had saved my life.
I'm not used to think that she's not really there now. I almost think she's gonna show up through the door, and in a way, she still stays alive in our memories and in our hearts.